I'll move in closer.
You move in a little bit. Low.
Ooh.
Oh, what we got?
Whoops. Whoopsie daisies.
On YouTube and Facebook as well.
Oh my God. First time ever. High five.
Yep, YouTube
Yeah.
Wait
Sweet.
for it.
All right. Well, welcome.
What would you like to talk about?
CEO Dr. Dierks. Why don't
Head
you
of
introduce
Education,
yourself?
Shaun Pitts.
Introduce yourself first. Who are you?
I am Travis Dierks.
Okay.
I am the son of Jack Dierks and Patty Dierks.
Oh, I love Patty.
My brother to Dustin. We should do introductions like Lord of the Rings. I'm Travis, son of Jack.
Just your lineage all the way down.
I wish I was related to Gimli, son of Gloin.
Why did you start EMSconnect?
Because there was a huge need in the rural community for better stuff.
Right.
You know,
Well,
garbage
welcome.
Or nothing.
Why did you start
Yeah,
EMSconnect?
they had no good education.
Because
So you just what?
I knew smart people
right?
like that guy. It took a while to recruit some smart people.
Per month.
Nice.
Right?
Yeah.
What else? We are cheaper than.
Well, everybody. So what happened was we undercut them, thinking, we have better stuff, and now let's get a lot of customers. And so we gave a lot cheaper price. And then what happened was they dropped their prices to match it because we were taking all their business.
Okay. Well, but the good news is we're still better than them.
Absolutely.
What makes our product different? Why are we different than other EMS platforms?
Well, we do the live stuff every month,
Okay.
including ALS, BLS.
Right?
Right?
Yep.
The content is always fresh. So every session we do every month is a new session. We don't
Right.
bring back old stuff and just recover it from the archives and not really refresh it, redo it. And so that's one thing that's always going to be good is it's the most up-to-date stuff with the new technical changes and national education, that sort of thing.
Right.
We try to bring on super specialized guest presenters like you had on David Gavatt one time, who
Yep.
wrote the
Great
book.
author.
Literally, who we have the book here. We have the book right here.
We'll talk about it in a minute.
Ooh, yeah.
Let's talk about it in a
Yeah,
minute.
we got book club later. But
Yeah, book club.
we bring on professionals who are experts in their field to talk about what they do. Like we had the police officer who all he does is street drug stuff.
Right.
He knows more than
He
every
educates-
physician I've ever met
Educates on
Yep.
street drugs. He
in
doesn't
regards
do
to
street drugs.
He does not do drugs.
No.
At least
Unless he's undercover.
Yeah. There.
And then I think he has to.
I don't know if that's allowed.
Are you a cop?
Yeah. So yeah, it's a combination. The recipe is extremely high quality stuff. Make it super available in the remote places where there's very little access, and you can do it from your phone. And at the same time, then the trifecta is the cost. We keep
Right.
it super low.
And then we never have paid actors.
Never,
We never read off of a script.
ever.
It's not recorded in a $100,000 studio. Just shy of that. Right?
Yeah.
In fact, this is people's look at our great recording studio.
Yeah.
This is what we got. This
Yeah.
is where we do all of our lectures.
Yep.
Right here.
We pull people out of the ER or out
Yep.
of their situation or out
Off
of the
the
ambulance.
street, off
Yeah,
the truck.
yeah, yep.
And we sit them down and
Yeah.
have them educate. And
And
then
nobody we ever have is like retired, not doing anymore. I mean, these are
No, they're
people
all
who this is their
active.
full-time job.
Yeah.
And so they come in, we pay them to come in and be a professional and teach. And when they leave here, they go back full-time to be a firefighter, EMT, paramedic, physician. Yeah.
And all of our content, 100% of it is approved at the CAPCE level.
Yeah.
Do you want to talk about that real quick? What is CAPCE? Why is that important?
So CAPCE used to be called C-SBEAM. So if you're older, you remember C-SBEAM. So CAPCE is the national accrediting body that reviews all ongoing educational content. And only after they approve your content can you use it for NREMT credits. So the NREMT doesn't approve us. CAPCE does. Once CAPCE says, yeah, you're good to go, then you can use our credits for NREMT.
Perfect. And our system, the system you built, right? Now, mind you, you didn't actually build it. You mapped this all out, right? But our system's great because you input your NREMT information into your profile.
Mhm.
You take a course with us, and in one simple click, length of hours, date you took it, all of that reports into your NREMT profile and allows you to allocate those hours in literally just seconds.
Immediately.
So recert is super
Nothing.
easy, right?
Well, that was one of the things. So when we built it, I took what I was doing at the time as an EMS advisor And you would know this on the other side, being
Right.
deep into your department of what recertification previously took. Tons of paper, tons of files, tons of tracking, marking off skills, all this paperwork and tons of time. And then God forbid you get audited by the state.
Right.
One of your providers is going to get audited and you have to produce all this garbage to prove they did what they did. And so when we built the site, the background of it for the agency leaders is it makes all of that simple. It makes
Easy.
it nothing.
Right.
So you can just quickly print off certificates, quickly print off a whole transcript for the year or multiple years, track skills, track everything within the site. And it makes it kind of a one-stop shop for both providers who just want, in their palm, anywhere in the world, education I can just complete right now, but also for the agency leaders, the whole thing, it makes your life simple.
And it's super accessible, right? We can watch this on our phones. You can watch this on your tablets. You can watch this on a TV screen. You can host a training at your agency with multiple people
in
involved.
your living room.
All of this is super accessible.
Yeah, because a lot of our rural agencies do monthly get-together sit-downs, and so they can meet at my house. We can have 10 of us go through, watch a session online. I can grant them credit, so we can grant a group credit, so then everybody goes on, takes their exam, and gets their certificate right now.
Right. So that's an awesome overview, kind of like what we do.
Yeah.
We want to open up. I mean, anybody on any of the joining us live, if you have any questions for us, we got, your background, Dr. Travis Dierks, right?
Yeah,
ER physician.
ER physician, yeah.
Super familiar with BLS and what are EMTs capable of. You have a pretty good understanding of the ambulance-based service and fire service. I'm an advanced EMT, so if you have any questions about patient care or protocols, anything like that, we're open. All of the chat boxes are open for us to be able to answer those questions. How to pass the NREMT.
That's a good one.
Study tips, right?
Ooh.
We don't know the actual key to unlock the NREMT, but study tips we'll more than welcome to give you. But do you want to do book club?
Yeah, let's talk about some books.
Books, EMTs and paramedics, EMS providers.
Yeah, I think
whether
these are
that's
just
personal or professional.
Good books that every person in this field, whether you're an EMT, a physician, a nurse, these are books that you should go through because there's multiple aspects of doing this work that come into play. And it's not just about knowing the content and providing patient care. Some of this is how to avoid burnout, what to do when you're in burnout, how to not ruin your career, how to not lose your career,
right?
How to end up not sued or in jail.
That's good.
For what you do. Yeah, so there's a lot of good books.
All right, so let's just randomly grab one, right? Well, let's go to the one you have on top.
Yeah, this is the
Sirens, Lights, and Lawyers.
Every EMT should have read by the time they finish EMT class.
Oh, hey, EMSconnect Parking Pass.
Look at that. Look at that. It's a good bookmark. So yeah, this was written by a lawyer named David Gavatt. He is in the California area, and this guy's background is amazing. So he is a previous paramedic, EMT,
lots
paramedic,
of street time.
Then went back to law school and became an attorney who now defends paramedics and EMTs. Right. But he literally wrote the book on how to behave properly, legally, ethically as a paramedic or an EMT provider, how to document properly, how to avoid being sued.
There's some case law in here that's
solid. This is like the holy Bible
another bookmark
of how do you behave as an EMT outside of the actual part of medicine.
It's super solid. We had him as a guest presenter, right? So we have a course that he did about how to CYA, right? Cover your ass.
A course and a podcast, right?
Course and a podcast. Yep, absolutely. The podcast was also there, available on all those streaming platforms. So check us out on Spotify, Apple Podcast. You're just searching for EMSconnect on Shift. Super great guy. Joined us. Will probably join us again for some other content, right? This is an easy read. It's written at the level of which EMS providers can read, which is
like a human being.
Kindergarten, right? It's got pictures. It's just a phenomenal book. So foundationally, any EMS provider, this will save your career. This will extend your career. If you're an EMT student, this will dive deeper into that medical, legal, and ethical chapter that most of us just kind of browse over and don't really spend a whole lot of time in. This is good stuff, right?
And it's something you should spend a lot of time in.
Yes, reference it multiple times. What else you got over there?
We've talked before about the Dunning-Kruger effect and a recent one. And
podcast on the Dunning-Kruger effect.
This is by Adam Grant called Think Again. This book is it's got nothing to do with actually being an EMS provider. This is more about making decisions and how we behave and how we should, think through things. And so when we talk about the Dunning-Kruger effect, really the gist of the Dunning-Kruger is knowing what you don't know.
Right.
So being able to say, I don't know anything about this, but I'm not going to fake my way through it, bullshit my way through it, or be dangerous. And so
Right.
the Dunning-Kruger effect is seen every day when you have like a new student who just got through school. Maybe they're in their first year. There it is on the screen. Beautiful. We've talked
Look at
about that
that.
before. That first hill we call Mount Stupid.
Mount Stupid.
When you're early in your career, you've learned a lot, you've gone through school, you feel very educated, and you are very educated, but it's all theory and you haven't been able to apply it yet, and you are actually extremely dangerous. And then what happens is you hopefully get humbled, realize you don't know anything, and you hit that trough of humility, we call it. And then
Well, this
as
says very nicely cultured.
culture, there you go.
Yeah, cultured.
That's a nice way of putting it. And then the gradual slope to the right is as you then progress in your career, like decades later, to the point of becoming an expert. But what's interesting about the Dunning-Kruger effect is if you ask experts to rate their level of skill, they will still rate it lower than earlier in that Mount Stupid. Those people rate their skill and knowledge far higher than the experts do, which is scary if you think about it. But yeah, this book is amazing by Adam Grant called Think Again. But it really addresses that if you think you know more than other people, you're in a bad place. And one thing that's funny in it that he says is the first rule of this club is like Fight Club, right?
Right.
The first rule of the Fight Club is of this club, you don't know you're in it when you're on the Dunning-Kruger.
Right. Absolutely.
Yeah, it's a club you don't want to be a part of, but you don't know you're in it.
Oh, solid. Look at that.
Yeah.
We got Think Again.
Oh,
Adam
look,
Grant.
there he is. Good-looking guy.
All right, my turn. We're gonna go. I'm gonna put this one on your stack because that's
I wasn't
yours
going
to
to talk
chat
about that one.
Yeah, you were.
Oh,
Come on, it's so good. I'm a big fan of Joshua Chase out of the East Coast of the United States, firefighter. He's a lieutenant. I believe he also has his paramedic. He's written a couple different books, Jump Seat Leadership. This one is Fire Service Leadership, the solution to all problems in the fire service. This one is an extremely easy read. You can kind of see the thickness of this book is pretty straightforward. I'm not going to give away the amazing amount of knowledge that is in this book, except for to Dr. Dierks. This is a great read. Jump Seat Leadership. It's a quick read. I bet you could sit down and read this probably in an hour.
That applies to my 3 rules. That's like fits right in. Yeah.
Right.
Yeah.
Yep.
Yeah.
So all of his books totally available. I think Amazon, you can get them. Joshua Chase, super solid guy. Again, on our podcast, came and talked about leadership. Amazing life story, went through some pretty heavy challenges in his life and has some great knowledge. Again, Jump Seat Leadership is great. This one, which is Fire Service Leadership, the solution to all problems in the fire service.
Nice.
All right, grab one from your stack.
We should follow. Yeah, let's do this one.
All right, what you got?
So through my career, I've had burnout multiple times. Okay, and this
You burned out?
multiple times.
No, okay.
Absolutely. Burnout's dangerous in every way: patient care, career, family, everything. This is called The Happiness Equation by Neil Parisha. I think that's how you pronounce his name. If not, I apologize, Neil. But this book has nothing to do with
He's not
EMS.
listening.
This is
Look
more
at
of
that.
just how to be a human being and get through your career and life, not being miserable. It's an easy read and some amazing things in there. It talks about the flow state, which I now talk about a lot. Like when I'm at home, if you're under stress, doing a project that makes you happy and getting into what's called the flow state, where all you think about is that one thing you're doing at that time. You're not thinking about the kids, the wife, the family, the money, anything, your job. You're in the flow state. And for me, my flow state is I have fly fishing, or lately it's been a lot of woodwork. So I go in my garage and I get into a wood project, and for a couple hours, it's amazing. There's nothing else on my mind. And you leave that project feeling fulfilled and centered, very balanced. So it's stuff like that. And it's simple things in life. It's nothing crazy. It's not like you have to go on these week-long excursions to find your happiness. It's just everyday stuff. Great book.
Nice. That one's good.
Yeah.
Let's talk about this one. Have you heard this one? Too Dark 30. This one's Mark Hill, M-A-R-C, and then Hill. This is true stories to inspire teaching and learning in our local heroes. So this is more aimed if you are an EMS educator, fire educator. This takes adult learning styles and how to educate adults in the EMS setting with some great practical takeaways. This was a phenomenal read. Mark is a long educator as well as a firefighter, as well as a paramedic. earned awards. This guy's super, super smart. He also, inside this book, has there's a website to get all kinds of free resources, lessons plans to use for EMS educators all across the board. So this one, as an EMS educator, is a must read. Again, you're going to want to highlight this, take notes from, and lots of great educational tools spread throughout this entire book. All right, what do you got over there?
I got another one.
Yeah.
This one, I can't believe you put this in my pile.
Yeah, because I never read it.
I wasn't going to bring. You never read it?
No,
Okay.
I can barely read.
So this one's a little laughable. Okay, I
Right.
can admit it. But again, it's to address burnout. It's called Itchy Go Itchy. Okay?
Itchy go itchy.
And what this is it's all about the Japanese tea ceremony. And the point of the book is it's not about the tea. It's about pausing in life and taking the time to take in the surroundings. It's a stop and smell the flowers book. And it's a good book to read of if you're stressed out, burned out, you feel like you're overwhelmed, you're constantly moving, constantly doing stuff, never feel like you have time for yourself. It's a book that teaches you it's okay to pause and take a break and enjoy doing something totally mindless, something that's just for you. So it's not about the tea. It's about the experience of taking some time for yourself to do whatever makes you happy.
I feel like the happiness equation in that one
They're
are
tied together very well.
Yeah. This one, have you read this one? I think you should borrow this one.
No.
1,000 Naked Strangers.
It sounds intriguing.
I'm sure it does to you. A Paramedic's Wild Ride to the Edge and Back. This one's by Kevin Hazard. This one definitely a little more diving deep into our world. So maybe whether you're new to EMS and you're just looking for a good solid read, this one, Kevin was a paramedic in Atlanta. So lots of great stories here. Great author, wrote some other non-related EMS books. This one's got some pretty comical calls. These are all calls that he's been on, kind of sharing with you the different EMS runs he's had over his career, whether they're comical or sad. Just a great lighthearted read. I think this one should be read by everybody brand new into EMS to get a good look of what that looks like. So 1,000 Naked Strangers, A Paramedic's Wild Ride to the Edge and Back by Kevin Hazard.
Interesting.
Maybe you should borrow this one.
So I got to tell you, I actually don't read medical books or EMS books in my free time. I want to do enjoyment reading. So I read books that I find either going to be educational, like something I can gain some new knowledge that might not be EMS stuff or medical. I would generally read for pleasure.
That's good to know.
Yeah. So like favorite book of all time.
Oh, what is it? What do you got?
No, I want to know yours. And it could be any of these.
I have read like 3 books in my life. Favorite book of all time?
Yeah.
Where the Wild Things Are.
That's a great book.
That's my favorite book.
It's a great book.
It's a great book.
Okay. Mine would be Atlas Shrugged by Ayn Rand. And I
Never
think
heard of her.
it's a book I made my son read before he left high school. It's a book that will challenge your thinking of what you expect of the world and other people.
Wow.
It's a great story.
Look
There
at
she
that.
is.
This is far deeper
I'm not going to
than
get
my
into this.
Where the Wild Things Are.
You can get extremely deep into this philosophy. So she started a whole philosophy called objectivism. I mean, you can agree with her, disagree with her, but her personal history is amazing when you hear where she came from and her parents, their experiences coming to America, the things they know about, the places they'd seen, and the politics they'd endured before they came here, and then her outlook on life. And you read that book, and at a young age, if you read that book, it will set in stone kind of your personality going forward. In the last time I heard, this was years ago, it was ranked of all time the second most influential book of all time behind the Bible.
Wow.
That's how impressive that book is.
Good to know.
Yeah. But you might see like in college dorm rooms, like when you drive by Gonzaga or something or elsewhere, you might see Who is John Galt sign in the window, and it's referencing that book.
Gotcha. Good to know.
Yeah.
All right. Last one on our desk here.
Good book.
You and I both really like this book, right?
Yeah.
Who Moved My Cheese? This one's by Spencer Johnson, MD.
Mm-hmm.
This one is management, leadership.
Oh, it's good for everybody.
This is a response to any change, right? If you
good
are
for teenagers.
Yeah, 100%. If you are reluctant to accept change, to work with your mindset of how to encounter change, EMS is never changing, right? It's not like protocols change or practices change or standards change. This is also another really easy read. We've also done another podcast on this one, right?
This is a good book because it will change how you react in
Yeah.
situations. I use this every day when I'm in the hospital. In the ER, I work for a big system. And anytime you work for a system, there's going to be changes you don't like or that make your life more difficult or more technologically difficult, patient care more difficult, or some administrative thing that has nothing to do with patient care that makes you angry, right?
Right.
Like, why would they do that? This book is all about dealing with change and change you might not like. And you just have to deal with it and pivot and do something else, find another reason. And that book really changes your life career wise and helps you avoid burnout. Be upset. You need to now, the cheese is moved. Let's move on. Let's find another thing to work on. And so now when there's big changes at work, I have a very laissez-faire, I could give a crap attitude because I'm like, there's always going to be change. I'm going to have to deal with it. Let's move on to the next thing.
And then it references when there isn't change or isn't, how is your mindset of keeping your shoes around your neck, which if you read this book or when you read this book, you'll understand that reference of tie your shoelaces together, hang around your neck, be ready for change, be ready to go out into the open and unknown and to search for more cheese.
Yep.
All right. Well, if you're just joining us, right, continuing education for EMS providers, 100% CAPCE approved, all of our courses, no paid actors, no scripts.
Can we pause for 1 second?
Yeah.
The audio is just audio bugged out. I'm just gonna reset it.
Cool.
Sweet.
Oh,
amongst yourselves.
Oh no, talk amongst yourselves. We're still live on TikTok.
Topic of
Oh, yeah,
conversation.
you keep going there and I'll work on
Okay,
this
so we're
section.
live on
Live on
TikTok.
TikTok.
Topic of conversation.
What do you got?
Worst case of all time.
Worst case?
Worst case for you all time. It could be, did it hit you emotionally? Was it technically
God.
tough and mentally? Did it about ruin you? Did you want to quit your career? Worst case of all time. Go.
You want me to give you the case or what?
No.
Early on in my career as an EMT,
Yeah.
The ambulance service I worked for used to staff EMTs for standbys, parades, the Bear Buns Fun Run, which is a run for nudists.
Run,
yeah, that's not the naked you thought you wanted to see. We would do football events, stuff like that, right? One of my favorite all time was rodeo.
Yeah.
Right? Couple of the local rodeos, PRCA sanctioned. So we're not talking PBR quality bull riders, but we're talking about, a little bit lower, like the minor leagues, right, of bull riding. So I got pretty good rapport with cowboys. Understand that first off, they don't want any help from EMS. They've broken
tough.
legs, broken arms, concussions. They want to get back on the next bull. They want to go to the next rodeo. So the mindset got pretty typical, right? So it was late. It was, I don't know, a little bit dark. I'm sitting on the rail looking towards the bucking chutes to my left-hand side. Bull riding's the best part of all rodeo, right? So bull comes out, rider gets thrown to the ground, and I watch this bull step on the chest of this bull rider. Instantly, right, you can see the bull rider kind of grabs his chest, kind of goes down to his pelvis. Bull fighters do a great job, get the animal away from the bull rider. Bull rider immediately gets up and runs towards the out gate that puts him in a safe area, right? So he is running past me, and I notice that he runs past me, gets in the safe area, and then just kind of lays down in the dirt. I got pretty used to just, hey, are you okay? Most answer would be like, yep, I'm fine. I don't need any help. So I said, hey, man, are you good? And all he said was no. So I hop off the fence, I walk over to him, and it's fairly dark at this time, right? And so he rolls over, and I can notice that his his hockey helmet that he's wearing, right, full cage helmet, is crushed, and it's like touching his nose. And I kind of look at his face and say, hey, good news. I think the helmet did a good job. I don't see any much trauma on your face. And he said, no, it's not my face. It's my nuts. And so I take my flashlight and start to pan down, and he is holding both hands over his groin area. Mm-hmm. And he's kind of starting to writhe around in pain. And I said, listen, man, you got to move your hands. And so as he moves his hands, I notice that there is tissue that gets kind of tossed into the dirt. And what I'm looking at is a complete rupture of both testicles. His scrotum is completely lacerated, and his penis is hanging on by just, I would say an inch, but probably a half an inch, right? And he's just holding this mound of what looked like, the best description is top ramen, just holding this, all the vas deferens, everything is smashed. There's blood everywhere. And of course, as a man, that was the most traumatizing thing I'd ever heard. And typical bull riding fashion, initially did not want to go to the hospital. He didn't want to go in the ambulance. He wanted his friend to take him to the ER.
Holy crap.
And he ended up signing a patient refusal. Refused. We adamantly, we did everything. We loaded him into the van with his friends. They drove him to Holy Family where he was seen.
The Holy Family providers
Not my problem, right? Yeah, 100%.
Wow.
But that's
horrible.
I save that story for people because
horrible.
I'm not a big fan of telling the dead people in car wreck. There's plenty of those stories.
People die every day, right?
That is the most.
No, that's honestly, I don't think I've ever heard anybody's worst case as, we had a cardiac arrest and they died.
Right.
Every human dies, right? That's
right.
part of this job. Get used to it. It's not about the saves. Every human will die at some point.
Yeah. We got a question from, we're just going off random stuff here, right? Sure. Do you guys think, us, critical care transport would be beneficial for Spokane specifically? So just here in Spokane County. You're a doc. I'm going to stay out of this one. What do you think? Critical care transport. I would assume we're talking interfacility. What do you think? Do you think it has?
I'm always a fan of high
here?
level of care for everybody. If you have the resources, funding, capability to do it, great. But again, we have flight services here with critical care transport, critical care nurses, critical care paramedics.
So do you think it would be beneficial outside of the flight service, maybe for a more available besides using the flight service and flight crews to do that?
I mean, the reality is I'm big on any better resource. I mean, that's why we have this company. It's a better resource than what was out there, and so we're going to offer it. And so if somebody had critical care transport and I had a critical care patient, I'm going to utilize that resource.
For sure.
Now, do I think that we have the numbers to need it all the time? I don't know if that's the case. So that's a lot of money to spend to create a resource that's going to be used occasionally. Because we have 4 ERs in this county.
Right.
2 of those hospitals, 3 of them have ICUs. 4, almost all 4 have ICUs. And so it's kind of like, how much are we going to be transporting critical care patients that we don't already do? I don't know. So I guess I'd have to know the backbones of that question a little more. Is there an unmet need they feel like they have, or is there a service that wants to do it? I have no idea.
I like it.
Interesting question.
Interesting question.
I feel like I just got baited into something very political.
What you don't know, right? Ground interfacility transports and 911. So critical care paramedics staffed on those ground ambulances that maybe have the knowledge, the certification level. And we're all about go get more certs. Like if you want to increase your knowledge base.
So I work at Sacred Heart, and we are the level, we're the trauma, stroke, cardiac facility, the big facility downtown. Yeah, thank you, Shaun. But I'm thinking, we get calls every day for transports from other facilities, a lot of rural facilities, very rarely from other local in-town facilities. So ours are usually rural to us, and those rural patients can be critically injured, intubated, on pressors and stuff. So yeah, there's definitely there's definitely daily transports that need critical care. Yeah, that the resources would have the cases.
I like it. Good answer.
Yeah.
Right. Well, do you want to go through? We got all kinds of great content. Do you want to go through a couple of these and just talk about what the program's about, or I'll give you a topic and you can kind of explain what we covered in that. I'm just pick on some of the ones you did.
Oh, good. Because I think if I didn't do it, I might not.
But then I think I'm gonna pick on one of these. You're gonna tell me what the course was on, and then I'm gonna read you some of the reviews that people said about the
good and bad. Do I going to talk?
I'm just gonna read all of them.
All the bad reviews.
How about crushed, collapsed, and compromised thoracic trauma triage?
That was a fun one. So I did that one, and we went through all the the typical thoracic trauma, back trauma stuff that, the medicine hasn't changed. People still get thoracic injuries just like they did 1,000 years ago. Maybe just the instruments are a little different.
Right.
A knife or a gun instead of a spear. High mechanism with car crashes and all that stuff. But the stuff we talked about in that was new and cutting edge is all of the changes in the thoughts and treatment regarding traumatic cardiac arrest. And that topic is really interesting, and there's a lot of stuff that goes against classical teaching over the past many, many decades. I don't want to ruin it. I definitely want people to go and listen to it, but the gist of it is we've really changed and done a 180 completely regarding CPR and resuscitation with traumatic arrest. So if you think you're up to date in your traumatic arrest knowledge but haven't updated it in the last 5 years, you might be surprised at what we talk about in that. We also hit spinal trauma and immobilization, backboarding, spinal motion restrictions, pretty heavily in that. But yeah, that's a good session for up to date and really seeing how up to date our education is.
Yeah, and here's what's great about all of our lectures, right? So they're recorded. We also offer them live every month, so you can join, interact with our speakers in real time. You can ask questions. We have interactive polls. We give away an Amazon $50 gift card live to someone, which I don't know of any other platform that does that.
Yeah, it's just for thanks for
Just
playing
for fun.
and engaging.
Yeah, absolutely. And then all of these have little one sheet, sometimes two sheet, kind of like takeaways, right? High yield points that we're talking about that you can throw on the training table. You can throw on the ambulance. Look at that. Your beautiful face right on the,
Yeah.
you got a little,
That's
a
what I
little
look like
midnight
with
shadow
glasses.
going on. Yeah.
You can always tell if I've been working some shifts lately because I just don't care and I let it go.
Yeah, true story. So you got one of those, the quick fact sheet is what we call those. End of all of our lectures, you get a post-test. Post-test is fairly easy in my opinion. They're
10
kind
to
of
20
softballs.
questions.
Yeah, 10 to 20 questions, and then a PDF course completion certificate that you can keep for your records. But again, with an NREMT, it's just going to automatically transfer those credits to your NREMT profile. Let's read some good and bad critiques of Dr. Dierks.
Let's do it.
Have you seen these?
No.
Oh, or have you read any of these?
Again, just like doing patient follow-ups, which I don't do. We just talked about this morning.
Why don't you do patient follow-ups?
Because my philosophy and what I've tried to teach paramedics that I train, early in my career, I was like everybody else. I wanted to know how my patients did, if I got the right diagnosis, if my treatment was proper, yada, 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 right? And I found that I would follow up on some and I would get bummed. Maybe I did a great job. Maybe I was right on everything, but maybe they didn't survive. Maybe they lost their leg. And I, for some reason, like, oh, that sucks. And I kind of get bummed about it. And then I started realizing, why am I following up? If I show up, I do my job, I do the best I can for that patient every time, I think about things critically, I do the right treatment, and I did my job how I should do it. I should walk away from that shift, and it shouldn't matter at all if they lived, they died, they lost their leg, they had a horrible outcome. Like, I did my job. And so I no longer follow up on any patient, ever. And I tell medics all the time, like, and EMS providers, when you contact me asking, hey, can you do a patient follow-up for me on this cardiac arrest? Are you asking because you want to know if you got a save? Because if that's the case, you are thinking about this wrong. Because I guarantee you every human being dies at some point. What you should be thinking is, did I do my job? Did I show up and I did good quality CPR? Did I do early defibrillation? Did I do what I was supposed to do? Was I good with the family? Did I talk about things well? Did I direct the scene well? Did I manage my crew well? And if that's the case, you shouldn't need any follow-up. You should feel like you did a good job and you should walk away from that shift not needing follow-up. You should feel confident that you are a good provider and you showed up, you did your job, now go home and be happy. So that's why I don't do follow-up.
That's good information. All right, so I'm going to read some of these, and I want you to respond. You're just going to respond to them.
Yeah.
Okay.
Can I be blunt?
100%.
Okay.
Absolutely.
Okay.
The blunter, the better.
Might
Now,
lose
obviously, I'm
some
not going to
customers.
say who said it or anything
Sure,
like
of course,
that,
of
right? Let's see here. I'm just scrolling because some of these are like NA, neutral. They put a period. Before we do this, why do we require a survey every
Thank you for asking,
single
Shaun.
time?
So
Every single time
customers
we do a
hate surveys.
presentation.
I hate surveys all the time. So the surveys are required by CAPCE.
They're not required by us.
No, we
That's
hate
craziest
surveys.
thing.
We hate them ourselves. They're required by CAPCE to maintain our national accreditation. So if you hate your surveys, you're welcome to email CAPCE and tell them, but it's a waste of your time. And I understand it. They want to know that your users are engaging and they're giving you feedback, and I will follow. We have had some feedback from users that has turned into major changes on our website. So sometimes the feedback we get is very, very useful. A lot of times it's reassurance and good feedback to tell us we're doing a good job. Sometimes people just want a place to complain because their life sucks at that time.
Yeah. All right. This one's going to be solid.
Great.
You ready for this one?
I'm ready.
This team of presenters went on and on about backboards and other topics. We need the point and then move on. Still, the women presenters have been the best presenters.
That makes sense.
It makes sense because women are smarter than we are.
So here's my blunt comment about
let's hear
that
it.
comment. So the first part of that,
You love backboards.
the
This is
first
a
part of that
personal
was
attack.
that we went on and on about backboards.
Why is that?
Well, okay, why do we need to go on and on? You'd think if we said it one time, the issue would be over and we would move on and we'd stop having ridiculous protocols over the U.S. So why do I still get patient after patient after patient on a damn backboard? If you're tired of hearing me talk about them, then change your policy, do the right thing, and stop putting people on backboards for every case. Now, with that said, I understand people are going to respond back, well, how dare you? We have protocols. If that's still the case and where you're working, you have a protocol that every fucking trauma gets put on a backboard, you need to address that with your medical program director and get it changed right now because you're, 15 years out of date.
Hell yeah.
Yeah, there's my 2 cents.
I like it. That was. Let's go with the more positive one. That one got you a little.
I'm pissed
That one
now.
got you a little bricked up.
Yeah.
This one says, very solid presentation. I enjoyed the presenter a lot. Good mix of slides, of shots of people talking, animated, engaged discussion. I appreciate the end discussion about actual provider folks can use for medical purposes. So that's a good positive feel.
We might need more positives. You got me all worked up.
Oh,
You
here it
just said
is.
the word
Dr.
backboard.
Dierks is the bomb. Love his presentations and his humor.
Got it. Funny, I just ordered a bomb today, a fake one. It's the truth bomb
Right.
to put in my office. That's good timing.
Let's see here. This has been the best class I have been involved with in EMS in years.
That's the trauma one we did?
That was the trauma one.
God, that warms the cockles of my heart.
When you said warm, never mind. I appreciate the fresh perspective and your enthusiasm about the material.
Yep.
And we're not making these up, right? This is what real people are saying. This is one of the best lives I have seen in a long time.
Oh, good.
This one's good.
Well, the point is, I think what people need to hear is you're not going to get BS from us. This is everyday common sense education with honesty. I mean, look at the site. We have no marketing. We don't take marketing money from anybody.
No.
I mean, not to say I wouldn't. If you're out there and you're listening and you want
You
to
wanna
donate money
market?
to this company, please donate.
Wait.
Yeah.
If you wanted us to help market something, you could send us a patch.
There you go. There you
Right?
go.
We could send us
And
a challenge coin.
we put those on for free.
We put those on for
So yeah,
all
there's
in the
no
background.
marketing money.
We're sponsored by all these great things on the wall.
Yeah, there's no
That's not
there's no money from any
Callahan Auto
company.
Parts?
So what you're going to get is 100% honest education that meets
Time out
national
for a second.
criteria.
That is the still frame picture you're going to use of me right now on that. Can you go like a half a second farther than
That's
that?
fantastic.
That's better. Thanks.
Is that better?
Yeah, I really appreciate
I'll
that.
pause right
Thanks.
there.
I like
that was
it
the
if we
word-
make you look
There you
dumb.
go.
Okay, that's better. Thanks.
Okay.
Good
So yeah,
God.
there's no BS, and the same goes for pricing. So I'm gonna throw this out there. So part of this company, I don't like to do BS. I don't want to waste my time. That's my biggest pet peeve is wasting time, and I definitely don't want to trick people. And so signing up for services, it's flat rate. There's no hidden fees. There's no sign up costs. No cancellation fees. For an EMS and fire, it's what
Can I
$650
interrupt?
a month.
Can I interrupt you for a second? I
What's
want you to.
this?
This is my new profile picture.
I paused.
No, go to the other one. Go.
I know he looked like
Oh,
that,
that's
so I did an angle.
fantastic.
Look at that.
just perfect.
Hell yeah. Yeah. Here, let me see
I
this.
like it.
We're gonna
I
show.
like that.
We're gonna show to TikTok, right? Look at
It's blurry, that's fine.
Yeah.
that's
That's
a good photo of you.
editing.
Mega mind.
Megamind. Someone, yeah. That's right. No camera on camera. Look at
That's
that.
the best we got.
All right, sweet. Keep going. Sorry, $650 a month for just the what were you saying? I
Yeah,
wasn't
EMS and
listening.
fire. It's what, $650 a person for your agency. If you want to sign up as an individual online, it's $7.50 a month for full access EMS fire.
Right.
Like that's cheaper than
That's cheaper than the meals you're buying in your ambulance. I guarantee.
Really?
You,
Yeah.
Right? Yeah. A Big Mac meal with extra large fries and a Diet Coke because you're watching your weight is still more expensive.
Yeah, and what's really
yeah.
cool is like you have your individual account or you join an agency and you have your account for 6 months or 6 years. You leave and go someplace else. You turn off your account for a while, and we never remove your stuff. It's always saved. It's always there in the background. You start up 6 years from now and you still have all your certificates. It's pretty
Yeah.
cool.
It's pretty great stuff. All right, let's pick a different lecture. What's another one you've done? You hardly ever teach, so
I used to. Well, the fact is, I used to teach every episode,
were
and I'm sure
every
people got
single
so
lecture.
tired of my voice that I had to bring on fresh blood.
Let's look at we have our live session, right? That becomes in our course catalog,
Yeah.
right? But then we have the BLS content. We just launched this a few months ago. We have people
big
talk.
hit.
It's been a huge hit,
Huge hit.
right? The idea of this is we are talking directly at our EMTs, that audience, right? So we're not talking about drug dosages. We're not talking about calculations. We're not talking about start NAVs. We're talking about just how to get better at being just good EMS providers at that EMT level, right? So let's look and see what kind of
bring up Quinn's recent one.
That's where I'm going, right?
Quinn's one of our new educators. She's fantastic. But yeah, the BLS sessions have been a huge hit for agencies all over the country. They just love it because so many of your providers are BLS. So yeah, the BLS providers love it.
All right, so let's see here.
That's nice.
Nice to see new faces.
See, I told you, they don't want to see me anymore.
Cool. Let's see here. I think the presenters are very knowledgeable and eager about the content, which helps it be very engaging. Perfect. Look at that. It's engaging even though it's recorded. You're not actually engaging with your screen, right?
The nice thing about having this company now is because we do now have a reputation and what I think is adequate respect throughout the EMS community, we can cherry pick our instructors and presenters.
Right.
And so what I've been able to do is bring on the best of the best. And there you got Quinn. Fantastic educator, well-loved, super respectful, professional, but, engaging and not boring. We try to avoid bringing on people who are just going to make you fall asleep. Because we got to get the education out there, and who likes to sit through PowerPoints in education? So we try to make it as fun and engaging as possible and bring on people that are nice to listen to.
I'm trying to find some, because we've had some kind of hurtful people. I'm trying to find some of these so I can respond. Yeah.
Well, and here's my opinion about negative feedback. Is I like negative feedback because it helps us make positive changes. Yeah,
constructive negative
What
feedback.
I don't like is people who just put feedback in because they're pissed off in life, going through divorce, angry about their job, burning out, and they want to just vent. If you're the type of person who just wants to put in a bunch of bullshit in your feedback just to cause pain and hurt and not give anything constructive, kiss my ass.
Okay. If you don't like Big Red, then let's see here. Let me ask you a question. So I'm going to read the review of this one, and then I'm going to read the title of the lecture. Okay. The review of this is, how was this subject remotely an EMT skill set? This was a paramedic and doctor discussion. Can you make this program more suited for us simple EMTBs? First off, I got a problem with the term EMTB. There's nothing basic about what we do anymore, right? We are emergency medical technicians. We got great knowledge. You should be striving to have great patient care. You should be doing thorough assessments. You should be gaining knowledge. You should be being a fucking professional.
Yeah, there you go.
Right?
Be a pro.
So that was the review of the lecture titled Critical Care Medications. So what part of that title does not tell you?
Yeah, and on our website, it'll have a critical care.
And then it says the lecture starts with, if you are an EMT, this lecture is not for you.
Yeah, there's a big chevron, yellow, black slide, right?
Yep, perfect. All right, great. I was just making sure we didn't miss that.
So somebody actually watched critical care medicines and then wrote that in there.
Yep. Yeah. Another valuable ALS topic. Love the in-depth medication review. A lot of the episodes are largely discussion-based, and I would prefer more presentations and information-based. I want hard information that can be remembered and utilized, not anecdotes. So what do you think?
I don't know. So anecdotes are good because bringing brings up those situations you can't plan for very well because you got to be on your toes and you don't want to be surprised in this job. You want to be prepared for anything so you don't freak out. Yeah, I mean, the anecdotes, I get it. People don't want to hear us go on and on about, this is what I do, this is my life, look at my great cases. But sometimes you learn a lot from those.
Well, this one's great. So this one also says, I'm an EMT, so it was a bit over my head, but I picked up good tidbits along the way. Thanks.
That's the goal.
That's the goal, right? You can be an EMT and take our critical care. All of our content on here is available to everybody at any time. If you're an EMT, you can take the critical care courses and so on. I'm going to read this comment real quick. I'm totally blown away here. Someone commented, more Quinn.
There you go.
Now,
that says a lot.
This seems slightly biased because the person commenting that is Quinn's significant other. So if you want to see more of her, go home.
Funny, my wife has not sent in a comment.
That's
more
your
Travis.
Mom, though. Your mom is on our platform. She
and she's
watches
on
our
Facebook.
webinars.
She might be listening
Maybe
right
she's-
now.
Wouldn't that be great? If
More
you are,
Travis.
do we want to call her out personally? Well, you already did.
No.
You literally.
She's great.
Patty. we
She's a
love
big
you,
fan.
Patty.
She's a big fan.
She's a big fan.
Yeah.
She's very. This one says Shaun is the man. I'm gonna save this one. That's the nicest thing
Screenshot.
anybody has ever said to me. The best refresher I've ever taken. Please keep up the good content.
Yeah, we have refresher
EMSconnect
courses.
lectures are always great sleep aids.
Ooh.
I sometimes fall asleep to lectures
Slam.
as it's good white noise.
Well, but what lecture is
But
not a good
you're
sleep
learning
aid?
through osmosis. So as long as you're laying on your computer, you learn more when you're asleep. So that
Better
guy
than
can
OnlyFans, right?
fuck off. I have no credentials in critical care or paramedicine, but I dove in anyways. Learned about meds not used in urban settings. All new for me. Thanks for the education on something I am not familiar with dosages and such.
Okay.
That's so nice.
That's nice.
Thanks.
That's a good
These
one.
people are so
See,
great.
that's good feedback.
This is great feedback.
Yeah.
What else? Do you want to read more of these?
Hey, can I just ask how's our audio on TikTok?
It's great. I'm hearing it just fine.
Nice.
Yeah. Oh, you just appeared on TikTok. Your voice.
Nice.
Sales team.
Salesforce.
Salesforce, as you might say.
Salesforce.
Salesforce.
Yeah.
We have a producer, Eli.
Yes.
Producer
Producer,
Eli.
editor.
Right, a little different
Yeah.
than Jamie, but just as readily available. Yeah,
We
he's
literally
about
have a
here.
pro YouTuber.
We have
in
a
the
pro.
office.
If you have never,
Hello.
do you want to plug your?
We need to
do you want to
plug-
plug? Are you sure?
No,
You
that's
don't need
all
to
right.
plug-
Dude, Call of Duty Mobile,
Not the
dude.
audience.
Hawk's Nest. Boom.
Hawks. Oh, damn! He just threw it out there.
Boom.
We have Dr. Dierks, CEO. Who else? We have me.
We have
An educator.
We have the Sarah Lynn.
We have Sarah Lynn, our administrative assistant, which
Yeah,
is
she's like
handler.
If you call EMSconnect with a problem, she'll solve it. She's got the hook. DJ.
Stop. Most watched or recommended episode. All right, think back at all the
Oh, that's tough because they all have a 3-year life cycle.
CYA is really good.
Yeah.
CYA is great.
Yeah.
Right?
They all have a 3-year life cycle. After 3 years, we got to remove them based on CAPCE requirements for
so what do we
national
got here?
accreditation. Yeah, CYA is very good.
So good. I'm just scrolling here. We haven't talked much about our fire educators.
Oh,
Right?
yeah.
And those
Shaun,
guys,
JP.
Shaun, JP, those guys did a
pros.
great lecture on families.
Yes, they
Right?
brought in
They
their
brought their
wives.
spouses and they talked about how does that work and what does that look like.
Yeah.
So that one I think
was a
as a
great
new
episode.
provider is pretty
Well,
solid.
their fire content, and I've never had any fire training whatsoever, and I've watched a lot of their episodes. Boy, you learn a lot.
Yeah.
Like even not even needing to know about it, you learn a lot about your home and how to protect it from fire stuff.
They give examples of how to have calendars that link together so that you can communicate back and forth. That one's really good. What else?
There's been a lot of good ones. I mean, we try to make every session engaging. We try to cover all the national requirements over 3 years from NREMT, but I mean, every episode has to be kind of fun and engaging, so we try to make them that way. And we have the live quizzes that you do that are just fun.
And great presenters. Now we got a couple of reoccurring faces, right?
Yeah.
Can't say enough about Dr. Eric Ernest.
Yeah.
Right? Wicked smart.
So that he is an
Heavily
emergency
involved.
physician, EMS fellowship trained physician out of Omaha, Nebraska. We trained at the same place in Omaha. He's part of the NREMT. He's on all sorts of councils. He does tons of EMS work. Genius.
That's one of the things we're bringing probably in 2026 will be an NREMT prep program for EMT students to be better successful, more likely to be successful on the NREMT.
Very nice.
Right? So we'll have some study help. We'll have some study techniques. We'll have some probably lectures that are pretty good for content and then a pretty extensive mock exam written by the test questions from Dr. Eric Ernest to get some
good resource.
Good NREMT style test questions, right?
Then we got Stanton.
It's Dr. Stanton, right? NASCAR physician.
Yeah, he's the on-track physician for NASCAR. So he's at all the NASCAR events in the suit with the
He's been
helmet
on
on,
television.
in the ambulance responding to all the
In
crashes.
fact, his ass has been on television
Really?
more than a couple times. Yeah, the camera really likes Stanton's
good-looking
butt.
Kentucky boy. Likes his bourbon.
Wow.
He's a good
Loves
guy.
his bourbon.
Good guy.
Yeah. Young physicians, right? Not old
talk about
physicians.
knowledgeable. He's got the science. That
Yeah.
guy talks numbers and knows the literature backwards and forwards.
If you're local,
he's
local in Spokane, you know, I mean,
Yep.
Dierks and Dang,
Yeah,
like
sure.
just two household EMS names.
And then Sherry Worrell.
Sherry Worrell, yeah.
Wow. Talk about
awesome
a
critical
flight
care
nurse.
paramedic. Yep,
She's a
knows
brilliant
babies. Yep, this is we got Dr. Dang. What else? Dr. Edminster's joined us for a couple lectures. Yep. Pretty solid dude. We've had authors. We've had, gosh, who else?
We've had a lot of people.
Had a lot of people.
A lot of people.
Yeah.
We've had, experts. We got the police.
But yeah, that's all we use,
got
right?
Lawyers, police, military, everybody.
Yep. What else? What else you want to talk about?
What do you want to talk about?
No, this is about
Let's talk
you.
off EMS. Let's talk about
what do you
something
want?
else. Like,
what about some questions we got here?
we have questions.
What do you use for intubation? Everyone has their preferred method. No patient presentation needed.
rock uranium. Etomidate because you shouldn't really see much of the cardiovascular effects, the drop in blood pressure like you do with propofol and some of the other meds. It's fast. It's faster than Versed. And it's just good for what ails you. You can give it to nearly any human being. There's some theoretical issues with stuff you don't even need to think about. But Etomidate's good for EMS. I think it's your go-to if you had to pick one. Rock uranium I pick over Sucks. VEC should be out the window. If you're still using VEC, you need to talk with your county protocol, people, and get it out the door. It's too long, and there's better options. I choose rock uranium over succinylcholine because succinylcholine has all the little side effects. The potassium, you can't give it with crush injuries, burn, blah, 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 blah. Overdose it, you're going to paralyze somebody, so it's just a perfect medication. Still pretty quick onset, lasts pretty short amount of time.
What was that one again?
Rock uranium.
Rock.
ROCUR.
Rock.
Rock.
VEC. Rock.
And VEC is just too darn long. There's no allergies to etomidate or rock uranium that I've ever heard of, and the fact is you're putting a tube down, so who gives a crap? And then equipment-wise, I love any video scope. I think it's just great modern technology. I use the McGrath just because that's what's available in my department. I've used glide scopes before and a few other ones. King has one as well. But just find a scope that you like and you get comfortable with, and intubation should go pretty slick.
Nice.
Yeah.
What? How about the shape you use for your bougie or?
So you have to look at the device you're using. If you're using a McGrath or a straight blade, a Miller blade versus a Mac blade, your tube and your stylet should match the curve of the device you're using. It should match it perfectly because that's where the camera is going. If you're using a Miller blade and you need a straight shot, your tube should be nearly straight because you should see the cords and you should go straight through them. So you just think logically about the intubation, about the procedure, what blade you're using. It should match that.
I like it. How about recommendations for the 500-pound crash airway?
Pray first, a little prayer.
Yes. Essential oils, a little lavender.
But so super obese people, the airway's tough because you got a lot of tissue on the chest. And so even angling the blade like normal, I turn the blade 90 degrees so I'm actually pointing the shaft at their ear. I insert into the mouth and then rotate, just like inserting an oral airway. You put it in sideways and rotate it around. So that's the trick to get around the big chest. A little prayer. The reality is it shouldn't be any different once you get the blade in at all. If there's neck trauma, sure, that sucks. You can't move their head around. But if there's no neck trauma, get that head tilted back. Improve those angles between the angle of your trachea coming up, your larynx, and the angle of your mouth. You want those angles to equal. So you got to really sniff position and tilt their head way back and try to get the angles almost identical. And you should have a straight shot.
Perfect. Those are all great things, especially for tips on intubations, kind of take away, right? Let's see here. Will you sit those patients up and or prone them in certain cases following intubation?
I would never prone sit up people all the time because
Can you repeat that one more time? The audio's kind of
Yeah.
in and out.
I never lay anybody prone afterwards because I
Producer's
still want to
fired.
see their airway and manage it. Turning somebody on their side is fine as long as there's no spinal or neck injuries. Fine. Typically, I'll intubate a patient and then sit him up a little more supine, lean the bed up, just because I want to prevent any gastric contents from coming up. You probably haven't put down a tube to suction that out yet anyway. Gastric contents from coming up is a good idea, and so I'll typically lean people.
Kind of waiting for other questions. You have this cigar in
Stogie?
your hand, right?
Yeah, so
You
I'm
can't
gonna give a
smoke it
shout
here.
out. So again, we don't do any marketing.
No.
And I can't smoke it here, so this will be for later. But so this is a company I recently found. It's called First Responders Cigar Company. It's an American company. I believe it was created, I've looked at their site, by some ex-military folks. And they make cigars and actually I think some coffee and some apparel. But their cigars are kind of cool because they name them. There's an Alpha, a Beta, a Charlie, and a Delta. This is the Delta version. But yeah, they're good American brand cigars. The tobacco probably comes from Nicaragua, where most of them come from. But
Right.
yeah, and just a little shout out to them. And hey, if they want to market, just
Nice.
reach
Hey,
out to
let
us.
us know. Let
Reach
us
out
know.
to
We
us.
will gladly
Gladly talk to you.
take some cigars
we
and
won't take
promote.
marketing.
Yeah. We
We're
can't
happy to
smoke
promote-
them, but we
yeah.
can smoke them after.
Yeah, happy to promote companies that we would agree with their
Careful.
policies. Yeah.
We
Yeah.
Never mind. Well, we're just kind of finishing this up. Let's see. Ways to connect with EMSconnect.
Lots
Right?
of ways.
We got
Ooh.
social media, which obviously
Multiple accounts.
Facebook, just look up EMSconnect.
X.
Instagram, look up EMSconnect. X,
Yeah.
look up EMSconnect.
Not OnlyFans. We're not on OnlyFans.
Not yet. Depends
Yeah,
on what
you
kind of,
could be.
What kind of? No, I
Shaun.
have the face for radio. We have TikTok,
Okay.
right? TikTok live now, first time ever.
Yeah.
We have a podcast on all major podcasting platforms. Not only do we have most of the audios from our live sessions and educational content up on those podcasts, no CE credit available for those. That's just for knowledge base. But then we also host authors, speakers, just great people from around EMS or somewhat EMS related information.
Yeah.
Right? That's on our podcast. Where else? Jeez.
All
is
over the
that it?
website. I mean, we have
Website.
multiple ways to get a hold of us through the website.
Right.
Email, phone.
Yep.
We have staff here Monday through Thursday.
And now coming to a conference near you, right?
Oh,
we
we're at lots of
have
conferences.
and what do we have? Why come see our booth at conferences? Free shit,
Yeah.
right? We got shirts, we got pens,
Prizes. We always
got
get prizes. People who sign up at a conference get special stuff.
Yep, we have challenge coins.
Yep.
Our challenge coin is highly sought after.
It's
Our
nice.
first one, is more of a novelty,
It was
right?
easy
Our
beginner.
second coin though is
It's real
primo.
nice. It's pretty
right?
choice.
It's pretty choice.
I highly recommend it.
What else do we have? We don't sell these hats. These hats
No,
are
no.
only for certain
Yeah, you gotta,
top level
gotta be part of the
educators,
team.
which is why I took
Yeah.
mine from someone else.
We got lots of shirts and
Lots of
merchandise.
shirts.
Yeah, lots of fun stuff we sell.
Some a little more edgy, right? Because we have a couple of
A little.
taglines. What are
A
our
little.
taglines? We have get educated.
Yep. Stop effing around.
We have stop fucking around.
Accuracy matters.
Accuracy matters.
Yeah. Those are the main ones.
What else? If you don't like EMSconnect, then we have that shirt coming
little Ricky
coming
Bobby.
soon.
Little Ricky Bobby. You got to be careful with that
Little
one.
Ricky Bobby. Yeah. What else?
Yeah, the conferences are going to be good. Hey,
Conferences
and
are
if you're listening to this and you're in a place where we really don't have a presence yet and you have a great local conference where you get tons of action and you think that people would like what we have, send us a message and tell us about your conference and we will get people there.
Absolutely. info@emsconnect.org. Like throw that. I mean, that's, you can questions, requests, feedback. You want to see more of us. We offer live, we'll come to your agency,
Yeah.
right? A little bit different cost price
Oh,
point
yeah,
there,
yeah.
but teach some courses there local. You want to see us at a conference educating. We got great people that have presentations, so we can teach at your conference.
Yep.
I love this question. I want to ask you this one. Do you ever get anxious or nervous about patients in the ER anymore? Or are you just...
It's a different kind of nervous. So I don't get anxious. My nervousness, if I have a bad patient, if I don't quite know yet what's wrong with them, but I can tell that they are circling the drain. And if I don't do the right thing, I'm going to lose them. That gets me nervous, but it's a nervous kind of energy that kind of turns me on, focuses me. I don't get kind of crazy because the calmest person in the room has their stuff together. So even if I don't know what's going on at the time, if I stay calm and I slow down and I think about things, cases go much better. And even if the patient doesn't survive, we generally did what we were supposed to do, did all the right things, and everybody involved feels better afterwards. Nobody's crying because they feel like, oh, we screwed up, we didn't do the right thing. People feel like that went well. The outcome wasn't one we'd prefer. Maybe we lost the patient, but everybody showed up and did our jobs, and we felt like pros doing it, and we can walk away with our heads high and feel confident the next case. So it's more of a focused nervous energy, but anymore, those worst cases, the multi-organ failure from sepsis or the hemorrhagic shock from the gunshot wound or something, all those cases, the management is the same. It's like what we talk about with the chest trauma episode. Of the management is very cookie cutter. You do this, and you do this, and you do this. And if that doesn't work, you do this. And so it's not so much that cases change from one to the next. It's, are you just following the protocols and what you're trained to do? And as long as you do that, walk away held high.
Head hell.
High. Head hell.
Walk away head hell. Got it.
Yeah.
All right. Well, do you have anything else before we cut these out? I don't think we have any more pending questions anywhere. I did see one that was up there and then taken away about what kind of supplements and vitamins do you take on a daily basis. But
do you take any?
I'm assuming he was looking at the size of your biceps and assuming maybe you take steroids.
I'm a flabby guy. No, I don't take any.
Nothing.
No.
Cigars.
I need to start working out more. Now my son's moved out and gone to college. He was buffing up. Now I've got a little more time, so I'm going to start trying to work out more, yes. I used to work out more in college, but no longer. My brother, 5 years older than me, get this, 5 years older than me, and he just finished an Ironman.
Wow.
Do I feel like a total piece of crap?
I'll bet you your mom is really, really proud of him.
Wow.
Where you,
bravo,
Jesus,
Dustin Dierks,
proud.
Ophthalmologist
That's right, we met him.
Sioux Falls, South Dakota.
Yeah.
Just did an Ironman triathlon, swimming, running, and biking.
Wow.
Holy crap.
What is the closest thing you've ever done to get close to that? Have you ever smoked a cigar, drank
I'm going to say this. So people out there, I don't promote smoking. I have a cigar probably, it was never for about 19 years because I have kids at home. I don't want to encourage that. I had a father who died of lung cancer from, he had smoked cigarettes, been exposed to stuff in the Navy. So I don't promote smoking, but I enjoy a cigar and I don't inhale probably now a couple times a month, maybe that. And typically on evenings when I'm not working and I can feel I'm outside enjoying, cold night air. It's like an itchy moment. It's not about the cigar. It's about taking the time to enjoy something for yourself.
Nice.
Yeah.
Well, as we kind of close this out, if anybody on any of these platforms have any episode ideas that you want to hear, you want to see, what do you want to see more of?
Yeah.
Do you want to see more of a certain presenter or a topic? Let us know. Drop it in the chat box. But what else? I mean, anything else you want to?
Yeah, give us your constructive feedback. We like the constructive feedback, and if you're just in a bad mood and want to complain, just keep it to yourself.
Are you reading these mean, hurtful comments? Shaun's hair care routine. It's very straightforward. Right? Shave.
Looks good.
What?
Can't see your head. There you go.
Well, there you go. Yeah. That individual with that comment,
Yeah.
I'll gladly give you a haircut, bud. I know where you work. I know where you spend most of your time.
Yeah.
Show up, and I'll give you a haircut.
Yeah.
Bald is the new beautiful.
It is.
Yeah.
It is.
Some of us get it naturally, and some of us have to.
Lindsey Vaughn wrote a book a while back called Strong is the New Beautiful, I believe. Good book. Wrote a book. Strong
right
is
up
the New
until
Beautiful.
She messed up her knees, I think.
She's up.
Yeah. All right. Well, I don't see any comments. Producer Eli. Anything over there? Social media
more
expert.
Whoa, we got a
Lydia?
final comment.
We got one more coming in, but the audio is lagging.
We may need to go live a couple more times to boost our
Yeah.
abilities on
Yeah.
TikTok. So watch out for us to go live.
Yeah, watch us for more live videos. Next, oh, we are. Holy crap. I almost forgot. Thank God. That's why director of social media. We are doing 2 live lectures this month. 2 of them. Those dates are, what are they?
October 16th and October 28th.
October 16th at 2 o'clock. We are doing live case review for BLS providers.
Fun.
That will be on YouTube. That will likely be on, it will be on webinar, but Facebook and YouTube live. We won't be doing TikTok, but great live presentation reviewing real case studies
That'll be
from
fun.
real providers
That's good.
and be able to answer questions, poll questions, things like that.
Yeah, don't miss out on those. And is that free to attend anybody in the country?
You can't get CE credit
Yeah.
by joining on YouTube or Facebook Live, but you can by joining the webinar, right? We'll have links to join those. They're free to watch every single time. They're great,
Yeah, so
amazing
tell your friends.
speakers.
These are
Yeah.
free sessions you can engage with providers in real time without even being a customer. And if you end up liking it,
Sign up.
Join, sign up, you get your
Yeah.
credit.
It'll be
It's
great.
not like you sign up for a year. It's month to month. Once a
Yeah,
month.
so that's our BLS Provider Essential. This is that's our BLS Provider Essential series case studies,
Yeah.
right? And then on the 28th at 2 o'clock, this one is going to be pretty amazing. That one is going to be live on webinar, like always. And that one, we are being joined by Major Crimes Detective Mike Drapo, talking about crime scene perseverance. Is that how you say that? Preserving
Preservative?
crime scene.
Preserving it?
Shut up. The 28th. Let's try this again. The 28th. Preserving crime scenes.
Nice.
Yeah. How do
That makes
EMS
sense.
providers not screw up crime scenes and contribute to issues when it comes to investigations? And then we're going to talk about safety considerations all the way from crime scenes to the ambulance bay, where we'll be joined the second half of the lecture by Dr. Eric Ernest, talking about ambulance safety, stretcher safety, patient safety in general. That one's going to be awesome. That one title is Safety on Scene from Crime Scenes to Ambulance Bays. Again, that's the 28th at 2 o'clock. You can register for that one as well.
These are
Should
getting
be awesome.
exciting.
They are
These
getting
live
really
sessions,
exciting.
engagement, this is getting pretty legit.
We're
Legit.
becoming more
We're
and more
after 12 years,
the face
we're
of
quite
EMS,
legit, yeah.
right? Education, at least.
Yeah, I mean, we're all over the country. So if we're in a place where you're listening to this and you haven't heard about us, let people know we are everywhere and nationally accredited.
Well, and what's wild is everyone, because the local people here really know us, right? I mean,
Yeah.
they work with us on a day-to-day basis. They go on calls. They don't realize that EMSconnect is used by thousands of people across the United States.
Every month.
As far as the world, we get military folks that get deployed. They're watching our lectures from overseas. They're staying up to date on their education. So we are literally worldwide.
Yeah.
We are
Well,
saturating the EMS
For military,
education
this
market.
is the perfect system because your account travels with you anywhere in the world. You can be linked to one or multiple agencies. You can move between agencies and agency managers. It is the perfect system for somebody who's constantly moving, traveling, and just needs to keep up on their CE with something standard while doing it super cheap. Yeah, there's our testimonials at the bottom of our website. If you ever want to see what people think about us or how they compare us to the competition, like Target Solutions, Vector Solutions, EMS One, I don't care, I'll name them. If you want to see what
Prodigy
people think about us,
EMS.
and how we compare, go read through those testimonials. These are actual real comments in quotes from people unedited, and we put them on because it's a badge of honor. I think these are great. It holds fast to what our motto is, what our plan is.
Yeah, heck yeah. Check us out. Again, our website. Curriculum is there. We have 100% online CAPCE approved EMS refreshers, EMT, advanced EMT paramedic. You can read all about us, about who we are, the different people we have on our staff. Link to our podcast is there. Pricing, which really our pricing is really straightforward. If you're just joining and EMS content, right? How much per month?
As an individual,
Yep.
$7.50
a month.
once a month, no contracts. You're not locked in for a
Nope.
year. And people
Cancel
always
whenever
ask,
you
why
want.
don't we do contracts? And my response has always been,
Because if you can take a dump in a box
Boom.
and slap a guarantee on it, All
There it
you know
is.
is you're guaranteed a
Yeah,
box of shit.
because all of these companies out there that want your money for the year, and I'm speaking to you agencies as well, any company that says you need to pay for a year membership is full of shit. Because
No
what they're going to
accountability.
do is they're going to take your money and then they're not going to produce quality. You're going to give them feedback. They could care less. So a company that takes your money once a month and could lose your business the next month is going to keep their head above water and watch what they say and do and follow the national protocols and provide high quality stuff to keep you engaged and to keep you coming back. That's good business.
Heck yeah. Nice work. Everything else on our website, again, you can reach out to us. You can also message any of these social media platforms. We have people watching those messages, the comments. Tell us what you like. Tell us what you don't like. Tell us what you want us to work on. All of that is available. So, hey, thanks for joining me.
Thanks
This
for
was-
the invite,
this was a good
Shaun.
time.
I really enjoyed myself.
Thank me for inviting the CEO, the guy that started the whole
You know,
thing.
this is a lot of fun. I don't get to do this anymore very much.
This is great. All right. Well, everyone, thanks for joining us live. We'll be doing more of these, so check us out. Tell a friend, share. Sorry for any technical difficulties. Hopefully next month we'll have our new producer who's capable of keeping up with any technological difficulties. Never mind. All right. Well, weird. The audio just cut out. It's the craziest thing I ever seen. Microphone muted.
It
Awesome.
was cutting out. I was like,
Yeah. You're like, oh, wait, how did you do that?
Come on, me.
All right. Well, everyone, thanks for joining us. Have a great